Thank you for joining us. I'm Naiba Reynoso. Ahead, back to school season gets off to a strong start, and the county increases coronavirus testing capacity. But first, the Tweetie family was living in their car for 4 months before calling 211 for help. Thanks to the efforts of the Los Angeles County Development Authority, they now live in a 2-bedroom apartment of their very own.
I was scared, well, we were scared that if we were homeless and someone found out we were sleeping in the car with our kid, that they would call DCFS and then they would take her.
What do you like about having?
My name is Tony. This is my wife, Crystal. My son, Tony, and Avea, my daughter. The real living situation in the hotel is bad because it was more random people coming through, drugs, you know, kids unsafe because they don't have no play area, so they were playing in the parking lot.
The county owns over 30 properties in the South LA region, and we rent these out to the residents at income-based. So we're trying to house homeless families first because they need the help the most. So I met the Tweeties back in September of last year. It took them 9 months for us to house them, and I've been working with them from so long, so you just have to you have to be patient, and you have to be saving and stay positive for the future.
One thing that LACDA was really right. He kept us positive because he was responding back to me in a positive way.
And then I really like how Michael made us feel like people again in our situation, and it just really felt good to know that he cared and he really realized what we was going through, and he just thought of us.
It's exciting to finally have it. It's a lot more house than I'm used to, but I feel blessed to have it.
And the kids are just running around screaming, just so happy, to get out of their motel. They've been in a 1-bedroom motel for 4 years, and now they're each gonna have their own bedroom, to grow, develop, and hopefully, achieve their dreams.
In the county, coronavirus testing capacity has increased by the thousands over the past few weeks. Supervisor Mark Ridley Thomas joined public health officials in Koreatown at a new testing site.
We're here at the St. James Church. We're here with St. John's Well Family Center, and they are doing mobile testing to make sure people are tested. Testing is key. And we have Cervicon, who has provided the mask for communities to distribute because you are not safe unless you're wearing a mask in the face of COVID-19.
We've donated today 2,500 masks. We are here today at one of the testing sites, and we are really appreciative of these programs, making sure that we're delivering and we're partnering up with a supervisor to deliver to these beautiful communities that are underprivileged.
The mobile clinic kind of goes to areas that are medically underserved. We're trying to, flatten the curve. So we're testing as many people as we can to make sure that, people who are infected isolate, reinforce the CDC guidelines for, hand washing, mask wearing, and social distancing.
Since I do work with the public on Fridays, if I have any kind of, COVID infection, even though it's a small group of us, this is great for peace of mind.
This is a way of taking it to the streets. We are here because COVID-19, the spread of the virus, can be slowed if we do our part. Wear the mask.
Back to school season can bring renewed anxieties to low-income families who are struggling to make ends meet. Supervisor Hilda Solis recently joined the Department of Public Social Services to hand out backpacks in an effort to help ease the start of the new school year.
Today we're going to give about 1,000 backpacks to 1,000 children today, and so we're very excited about that.
It's priceless. What a joy. It's like Christmas in August to be able to see these youngsters that don't have the opportunity maybe to have toys and backpacks and school supplies right now because they're all on limited incomes.
We actually created a wish list with DPSS and the Toy Loan Library so that people can actually purchase toys and other needs for families. And we're so happy to see that come to fruition today.
We have pencils and calculators and notebooks. It's an opportunity for DPSS to give back to our families and to be able to make sure that they're ready to get back to school.
And it gives children that ability to be children and to also learn and to have a good time in their time as they're home right now with COVID-19.
Thank you for the backpack. This is a good help and it's a good thing for the children.
Thank you.
Doctors from across Los Angeles County are here to provide you with their insight as they continue to respond to the COVID-19 pandemic. Take a look.
Hi, my name is Dr. Tasha Dixon, and I'm the lead physician, family medicine at Los Angeles County's Martin Luther King Jr. Outpatient Center. So LA County is reopening, but the threat of catching COVID-19 is still very real. It's extremely important to remember to still wear your face coverings, to practice social distancing, and to practice hand hygiene, hand washing when at all possible. So while you've protested, you've got the right to protest, especially in this day and time, but remember, you've been in a large group. It's possible that you've been exposed to COVID-19. We recommend that you quarantine for 14 days or 2 weeks and that you stay at home during this time, just emphasizing self-quarantining at home. We recommend calling your doctor if you develop any symptoms, which include fever, cough, shortness of breath, chills or repeated shaking with chills, unexplained muscle pain, sore throat, or new loss of taste or smell. If you develop any of these symptoms, we recommend calling your primary care doctor or calling 211 for more information in regards to testing. Absolutely. First, we recommend calling your doctor, calling your primary care provider for more information about testing. If you don't have a primary care provider, please consider calling 211 and we'd be happy to get you connected with one. For a list of testing sites, please visit our website at covid19.lacounty.gov. But remember, we recommend testing for only those that have symptoms or those that are over the age of 65 with a chronic medical condition. I know that we're all tired of this. This has now been going on for a few months, but this time is more important than ever. Stay home if you can. It's just important right now for us to be diligent. Let's think about our family and our friends and our loved ones that may have chronic conditions, that may have decreased immune systems, that may not be able to fight off the virus the way a healthy person could. We're in this together. If you need us for your medical needs, we're here. Los Angeles County is here to serve you. We're in this together.
Got 60 seconds? Michael Contreras is the Director of Emergency Operations at the Department of Public Health. He coordinates the distribution of PPE that comes from the federal government. Here's more.
My name is Mike Contreras. I'm the Director of Emergency Operations Program for the Los Angeles County Department of Public Health. Part of my responsibilities as director is to also be the Strategic National Stockpile Coordinator for Los Angeles County. That means that I have to prepare plans and programs to be able to receive medications and supplies from the federal government and push them out during a health disaster. So for COVID-19, PPE essentially boils down to the personal protective equipment that is required to ensure that personnel are less susceptible from becoming infected with the virus. So what you see behind us are both masks, gloves, hand sanitizer, gowns, many other things that we push through. For us, pushing out PPE to our clients to making sure that people are prepared and people are protected is something that really, it's an intrinsic motivation for us, and it really helps us to feel like as though we're really contributing and doing something good for the county.
Thanks for joining us. We'll see you next time on LA County Close Up.